is that it happens at many different ages, not just advanced age. If somebody comes in, they're 90 years old, it's kind of reasonable to expect that they may not be able to do the same level of Sudoku they did when they were a kid, if there were Sudoku when they were a kid. So what does it mean? What does dementia mean? What's the implication of dementia? So dementia is actually a group of different impairments. It's not one thing, but it's really a symptom of at least two areas of the brain, aspects of the brain that may be simultaneously disrupted. So it could be executive function, which is the ability to formulate and to work around problems. And it could be domestic problems, it could be business problems, it could be interpersonal problems. But most typically, it's memory, short-term memory loss and judgment. These are the two that usually go first. Long-term memory, not so much. Short-term memory, you can't remember what you did this morning, 20 minutes ago, but what you did as a kid remains intact. Judgment, gee, I just burned down the kitchen, or gee, I ran the car out of gas again. Now you're going to go, well, we all run our cars out of gas. I almost did this yesterday. However, I knew I was running out of gas.
Right. It's when you don't.
It's when you don't that you have a problem. Did you not remember to pay the rent? Did you not remember to pay the bills? So this happens to a lot of different people as they start approaching or when they're well into their senior years. So what are the symptoms of dementia? Why do you really care? Forgetfulness is number one. That's the one we most think about, where you start to pretend that like you're, I don't know, maybe like Joe Biden, but you have limitations in your social skills. You might find yourself snapping at people where you didn't do this before. Your thinking is impaired, and you may have difficulty with your daily functions, the sorts of things that you have to do to survive. Running out of things, buying too much of things, finding that you use the wrong room as your bathroom. That happens.
Wait, what?
Yeah, you find yourself, peeing into the
hamper?
into the plastic plant or something along those lines.
Okay.
So these are the sorts of things that we look at and we kind of laugh about, sort of, when it's not you. If it's your dad, your mom, we don't laugh quite so much. If it's somebody else's mom or dad, everything is on the table.
Fair game.
You got it. So dementia. So what is dementia? People like to pull Alzheimer right out of the chute. Alzheimer's dementia. It's got to be Alzheimer's dementia.
Wait. Are they even the same? Isn't dementia more of a symptom?
Dementia is an illness. It is a symptom. It's a constellation of symptoms.
It's all kinds of stuff.
But Alzheimer's, what they pull out. So, well, you must have Alzheimer's. Well, Alzheimer described something called pre-senile dementia. This was senescence. This was dementia in younger people. And there are many different causes for this other than just Alzheimer's, as that was once described. Lewy body dementia is another one. Mm-hmm. But there are lots of things that can cause dementia. And this is the problem. And this is really the challenge that's out there right now with regards to family members that may be so affected, or if you're so affected, or if you think you're so affected. So Alzheimer's disease, which is is a issue with laying down something called amyloid, which is a proteinaceous substance that goofs up the brain. About 60%, this is what's going to happen. You'll see ventricular atrophy. There's these areas of the brain which are filled with CSF, cerebrospinal fluid, and they start to enlarge. Why do they enlarge? Because the tissue around it's starting to die back. But there's also vascular dementia. That may be number two. Vascular dementia follows things like diabetes. It may follow infectious disease, kind of akin to COVID and some of these other sorts of issues. It certainly followed influenza. So von Economo's encephalitis is a type of dementia that followed influenza. So people that are out there talking about, well, gee, COVID's a pretty mild illness, it is until decades later when your brain starts to fall apart. So this is a big deal if you're a student of history, medical history. Your doctor should be a student of medical history, but so frequently they are not. They barely know what's going on today. Hypothyroidism can cause dementia. This is a treatable cause of dementia. Easily treatable cause of dementia. Hypoadrenalism, your adrenals start to break down either due to medications, illness, or just age. Things don't work right if you don't have enough cortisol, pregnenolone, or any one of the other 150 adrenal hormones. Vitamin deficiencies can cause dementia.
Really?
Yeah, kind of cool, isn't it? Vitamin
Yeah.
B12 can do it, B6 can do it, B3 can do it, B1 can do it. So, the trick is not to be one that has dementia, if you get me. Thank you. That was
Bingo.
pretty fast, wasn't it?
Yeah, it was quick.
And then here is the take-home message. Over-the-counter medications can cause dementia. So if this doesn't worry you a little bit, it probably should. So antihistamines, cold preparations, can cause every one of the symptoms of dementia. And it happens when you hit about the age of 50, sometimes younger, sometimes older. So why do you really care about this? These are over-the-counter ways of goofing yourself up. And you're going to think, well, that can't be correct. Oh, it's very correct. What are the medications that we use to treat Alzheimer's? These are histaminic and cholinergic compounds. What are you getting for your cold, your sinuses? These are antihistaminic, anticholinergic. They work exactly the opposite way that the medicines that treat Alzheimer's. So one of the first things I do when I bring people through the front door is I ask them to bring everything you're taking. That does include over-the-counter medications, because it's shocking the number of people that are making themselves sick. Things like Elavil, amitriptyline. It's an antihistaminic. It will cause dementia-like symptoms. How many people out there are taking amitriptyline to help them sleep? It's shocking. These are tricyclic antidepressants. They're used not so much to treat depression anymore, but they get used all the time to treat sleep disorders. But it will put you to sleep, if you get my drift. So where is the disease located in the brain? You're going to go, well, gee, it's got to be someplace. It's no place. It's every place. Well, it typically starts, in a region called the hippocampus, which is in the center of the brain. It starts to affect the entire brain pretty much all at one time. Rarely do you see people have motor skill issues. You may have difficulties remembering things, patients' names, persons' names, friends' names, and whatnot. The doctor's office, it's usually good for a few laughs. Can't remember the diseases that he's trying to, or she's trying to treat you for. And you may have difficulties with learning and other sorts of memory. Mm-hmm. And so now that you kind of know what dementia is all about and what Alzheimer's may be and why grandma may not be doing so well when she goes ahead and tries to eat her toast in the morning and butters it with with something other than butter.
Yeah.
It's kind of a problem. So what sorts of medical conditions? What are the sorts of things that can cause dementia? Now, you need to know this because it's not all, you're done. You've got dementia, you're finished. We better start looking for a memory unit for you because you're going to be wandering around aimlessly in about 6 weeks. So comorbid issues include things like hypogonadism. And you're going to go,
gonads?
Gonads. It's already, we're getting down into that, aren't we?
Gosh.
And we're going to come back.
And on that note.
Yeah, on the gonads, we're going to come back.
We're going to leave you hanging.
Yes.
Really? Did I really?
I think
did.
you just laid an egg.
I didn't mean to. We'll be 23680 is the text line. If you got some questions, just leave us enough information to help the doc out with the answer. Or you can call us
tell us what's wrong with you first.
407-422-1212.
Yeah, the doc's getting old.
You can also watch us on Facebook, Twitter, Twitch, YouTube.
Periscope.
Right.
Parlor.
Parlor. Oh my gosh. Okay, hey guys, welcome. How are you on the internet? Hi. Thanks for joining us today. I appreciate that. There's a lot of folks watching. No questions. Apparently, you must just be wowing the people.
No, actually, that's working out pretty well because that way I can get through this,
right?
And then start taking the calls on it. Because what's going to happen is there are going to be people that are going to say, "Hey, what did you say about X, Y, and Z? Could it be this? Could it be that?" And that works out very well. The real problem with being interrupted in the middle of it, which, by the way, is not an inconvenience for me, is that I sometimes don't complete the entire show. It happens that way. I look at it at the end of the day and I go, I forgot to mention X, Y, and Z.
So close.
Yeah, well, I've started actually. This is in 25 years. I've only started this in the past 3 weeks, and that's to jot down an outline. So things I will get to.
Prepared.
Well, I used to really prefer to go in absolutely cold. Yeah. When I first got started with this, the first 15 or 16 years of it, all right, I would have my co-host pick a topic, announce it all week, and not tell me what it was.
That's fun.
Yeah, so I'd come in absolutely cold. It could be anything, and that's actually
That's fun.
It is
right.
fun. I got to
That is
tell you.
fair enough.
Once
Okay.
in a great while, it would raise my blood pressure a little bit, but for the most part, it didn't.
No?
So, this topic today I started working on this about 35 minutes ago.
Oh, stop.
Yeah, it was. Just before you got your copy of it. So.
Yeah, you've been working on this I mean, you know what I mean.
No, I've been working.
Don't go changing, Doc.
No, actually. It was my brother-in-law, actually, that got me interested in doing this. He's 12 years older than I am, and he's starting to fail.
Uh-oh.
So my sister's telling me about it. So I decided to put the show together. She's in Austin, so that she could listen in and pick up on the stuff that I couldn't mention on the telephone.
Okie dokie. All right, we also have a call, so let's go ahead and...
Let's finish up. I got 3 or 4 things I got to mention, then we'll pick the call
Hey,
up.
guys, welcome back. 3 or 4 things Dr. Dave wants to mention before we get into the phone calls here. We have been talking briefly, just started, about dementia and also maintaining good brain health. With that in mind, you left us dangling.
Yeah, okay, so I wanted to mention some medical problems that can cause dementia. Why this is important is because if you can identify what's causing something, you stand a reasonable expectation to be able to fix it. Don't you think? If you don't know what's going on, you're going to blow it every time. So hypogonadism was the first one that rolled off my tongue, as it were. Okay, what does this mean? Well, it means that as we get older, testosterone levels drop in men and women, estrogen levels drop in women but not in men, and progesterone drops all the way across the board. And this leads to a change in the way you think, the way you perform, and pretty much your overall health. These hormones need to be there, and as we get older, it's nature's way of knocking the bloom off the rose bush. It's just the way it works.
Okay.
So you need to know what your estrogen level's doing, otherwise you're going to become demented. Women, that's the way it works. Men, they have too much estrogen anyway. They tend to get a little old and let's just say emotional as they get older. But alcoholism can change the way that you think, and it will change the way your brain operates. So there's something called Wernicke's psychosis, which is from alcohol directly. It makes you nuts. So alcohol overabuse can do it. Other drugs as well, oddly enough. Then infections. So this is key, because we're looking at a pandemic where millions, hundreds of millions of people are going to get infected with COVID, and they're worrying about what the side effect of the inoculation is. It's like, what kind of stupid are you?
Yeah.
The real question is what damage is the virus going to do? You're going to end up with trillions of copies of COVID floating around your system, and you're worrying about one small messenger RNA, just one gene product that can't cause the disease. You're worrying about that side effect, and yet, okay. So you're either a coward or you're stupid if you're not getting it. All right, but other infections like syphilis and AIDS, these we know about. They cause all kinds of problems. So, when you're looking at rapid causes of Alzheimer's, and this is really going to be the major take-home message. So all of a sudden, grandma, mom, aunt, June, whatever, took a south turn. What's it all about? And you think, well, I think it's just time for us to start having that hard discussion with her, when in fact, there are medical conditions that will go undiagnosed or misdiagnosed that are entirely treatable if somebody decides to speak up and figure this out. Number one, with a bullet, okay, is urinary tract infections. UTIs, as they're known in the trade. This is the number one cause of admission from the nursing home, assisted living facility, or memory unit to the hospital. It's the number one cause. And what happens is they have a urinary tract infection. It percolates along for some period of time. Could be weeks, could be months, could be longer. And then whack, they become septic, out they go, and they end up in the hospital. And this is a huge economic hit for the nursing homes, ALFs, but it's a bigger hit for grandma. And so urinary tract infection is number one. Number two is pneumonia. You can end up with upper respiratory tract infections that cause hypoxemia, that's low oxygen levels in the blood. And wouldn't you know it, your brain needs oxygen every bit as much as your muscles do, don't they? So those are the two big ones. But then there's some softer ones, things that you need to consider. Congestive heart failure. Look at her or his legs. Are they swelling more than usual? Because congestive heart failure can lead to dementia, and it's a simple matter sometimes to go ahead and flog, as they say in the business, flog the heart with something like, there are medications that we can use to increase cardiac output, either by afterload reduction or inotropes. Okay, it's just the way these things work. So you may want to go ahead and start looking at the old foxglove derivatives, which is my favorite way of doing it. Small strokes, cumulative effect. And these are the things that we need to worry about. So what can you do as a younger person without problems do to prevent dementia? And this is key. One of the biggest shames in life is to go through life with hypothyroidism, not know that it happens, and then end up with dementia from it as you get older. Shocking, the number of folks with something called euthyroid sick that present as dementia. I get them in the office all the time. Let me see grandma. She comes in, what is wrong with her? First thing we check for is urinary tract infection. That's 30% of the people out there have an asymptomatic urinary tract infection. You fix it, and wouldn't you know it, they start thinking again. Thyroid disease, hypothyroidism is so common and so poorly diagnosed by most clinicians that it's a shame. It's criminal. Well, we did a TSH and it was normal. What the heck does the TSH have to do with T3 and T4 levels and the fact that mom's temperature is 96? Do you not understand that maybe the pituitary is wrong? Maybe TSH isn't the only way to make these diagnoses. And then taking a good hearty listen to the chest. Do you feel air moving? Do you see air moving? Can you sense it? And that's just the way these things operate. So you have to make sure that you have the thyroid workup, adrenal workup. What about the adrenal glands? Who the heck ever gets their cortisol level checked? Kind of rare, isn't it? What about getting your pregnenolone level checked? It's known as the memory hormone. Too low pregnenolone, the memory doesn't work. It could be just something as simple as taking pregnenolone to fix the whole problem. So gonadotropins, testosterone in particular, estrogen secondarily, thyroid, cortisol, pregnenolone. These are the things that you need to know are the levels, just so you can know where you're going. So what do you do for intervention? Figuring out what's going on and where you are is key to this business. It's all done with blood work, not saliva testing, not poop testing, not pee testing, but blood work. You want to know what the hormones are doing, what the balance is, and then you start restoration, which isn't all that hard. So bioidentical hormone replacement, starting with thyroid, adrenals, and then going through the gonadotropins. That's what you want to be doing. And wouldn't you know it, things like diabetes straighten themselves out in the interim. So what have we got on the horn? Who is calling in for us now that I'm finished with my ramble and I completed it on time, which is shocking.
Hey, Ray. How you doing? All right. Ray's from DeBerry. Go ahead and give the doc your question.
What's up, Ray?
Hey, Dr. Klein, I hope you do a better job than Dr. Google did. I've been trying to get off the sugar and carbs the last 2 weeks and been fairly successful. But last week, I developed weakness working out. I work out 3 to 5 times a week on an indoor weight machine and do up and down the stairs. And it's just like I'm out of steam halfway through anything. And just walking around, I feel like I may go down, and I've had a dull headache.
All right.
And feel faint. But I also have adrenal adenomas that are at 8, that are fatty, and of course, Addison's came up with those symptoms.
Wouldn't you know?
I don't know if this is sugar withdrawal or what's going on.
All right, Ray, it's like what you've got there is actually it's far more interesting actually than the typical caller. Number one, when you first go on a carbohydrate fast, you burn out a substance called glycogen in the liver. Now, your body needs this glycogen to exercise. It's the fast fuel. Your body goes for it first with regards to exercise. So the fact that your exercise tolerance decreased after pulling fructose or carbohydrates out of your diet comes as no surprise. It takes a while for that to balance again. So there are a couple things that I would suggest that you do, one of which is not freak out, understanding that you're changing a major habit. It's kind of akin to taking an aircraft carrier and trying to spin it on its keel. It doesn't work that way. It takes, 50 miles to turn it around, bring it the other way. It doesn't take that long with human beings, but it does take a lot longer than 2 weeks typically. Adrenal dysfunction is something that's fairly easily sorted out. What I do in my office is I'll do ACTH levels and pair it with cortisol levels. That's an ACTH to cortisol ratio, DHEA to pregnenolone ratios, and you can tell whether or not the adrenals are working. So yeah, you may have let's say lipomas in there. It's unusual. You may have fibroadenomas in there. More typical, you may have any number of other problems with the adrenals. Doesn't necessarily mean you have adrenal dysfunction. You just want to do some blood work to sort that out. Is there a relationship between cortisol dysfunction and insulin dysfunction? The answer is yes. Without having these chemistries in front of me, I really can't give you a particularly intelligent answer or suggestion as to what to do. But what I will do, in the absence of having an interaction with you or blood work, I'm going to make the following suggestion. If you're working out in the gym and you're saying that your exercise tolerance has decreased, rather than going back to the pieces of bread, toast, or candy bars, you want to use something called medium-chain triglycerides, or MCT oils. So I will have my patients go ahead and take a protein shake, which is a good way to deal with this. To that, add either a piece of string cheese, which is about 100 calories of mozzarella. It's a good way to go. But add 1 shot glass of MCT oils to your shake. And that will give you the sort of improvement in your, let's just say your tolerance, your exercise tolerance, than about anything else. Individuals that need a little extra kick, let's say professional athletes, what I'll have them do is as above, but I will add acetyl L-Carnitine and alpha-lipoic acid to the mixture. This is for people that are doing it for performance, not necessarily for muscular tone. And I wouldn't want you to waste your money on that unless that were something that you're trying, let's say you're trying to impress the other folks in the retirement community.
Oh, stop it. Thanks, Ray. I appreciate that. Ray's line is now open. We have a couple of texts that came through.
Let's take a text.
It looks like a gal here says she does hair. A lot of customers complaining they've gotten the different vaccines, and all have gotten sick from Moderna, Pfizer, all were just the same. Now, I'm not sure what sick means. Does that mean you had a headache and you didn't feel good?
Well, here's the real problem, okay? It's the do-it-yourselfer, the DIY. So we're going to pick up after these important announcements about the different vaccines.
Okay.
There's always a call about the vaccines.
Always. So we'll address the vaccines, but first, little news, traffic, and weather together, because, it is News Radio WFLA Orlando. And right now, you are listening to Stages of Life Radio. We are live, and you can text in 23680 is the text line, 23680. Phone's open at 407-422-1212. Check out stagesoflifevitamins.com. I think you'll like it. There's the button. It never starts when I want it to. 3.5 minutes. I have to do math. Hold on.
There we go.
What math?
Yeah, it's an egg timer.
No, it doesn't work that way. It's a dust. I could set the brakes to a certain amount.
Really?
Yeah, but you wouldn't want that.
No. Well, it's like being syndicated. There's a reason I don't syndicate this thing.
Well,
You have to be regimented, and you have to be a little bit more disciplined than I am. You can't talk for 24 minutes. You only have 22 3/4 minutes.
exactly.
Oh, man. Yeah. The first time I was offered syndication, I said, that makes it work, not fun.
Exactly. It is. It's a lot of work because everything has to
Well,
be
you syndicate all
set.
kinds of shows. So you
I know.
You do it for a living. Me,
I know things.
I do it as a hobby.
Yeah.
It's very different.
That's true. Hey, everybody. Thanks for tuning in. Melissa Fox here. Appreciate you. And we are doing the show because that's what we do. So far, you must really be kicking ass and taking names because everybody that's watching is like, yeah, I'm good. I'm just watching the show.
Well, fair enough.
Yeah, very much so. So anyway, back Tuesday night, you'll be back in here. We will address this dementia and maintaining brain health.
Yeah, but we're
again.
the show goes Thursday though.
Yeah, well, it plays back Thursday.
Yes.
But we also record it on the internet on Tuesday evenings at 7.
Oh, it's very confusing to me.
No, it's not. Now, listen. Here's the deal. You gave Lizzie an option of either erectile dysfunction or maintain dementia, and she said, how about we just mash them both together? We'll talk about the dementia of erectile dysfunction and maintaining.
The problem with dementia and erectile dysfunction is that you forget that it used to work.
They go hand in hand.
Yeah, it's kind of like, what's that for?
Oh, that's
horrible.
Really?
But it's actually, oddly enough, one of the last thing that goes in nursing homes.
Yeah, I've heard that.
Yeah, it's true. The brain goes first. The genitalia may take a little longer.
Catch up.
Yeah. So what have we got? So we're gonna wait until we go back live to do this.
I tried to ask that gal to check in, but she said what she meant was I'm not comfortable being on the air. Sorry. Oh, really?
Yeah. So the deal with dementia. Okay. The take-home message with the dementia is it's not a write-off disease.
No.
You have to be willing and, in fact, eager to try to dig into it to see whether or not there is some cause that is being overlooked.
Sure.
And it's a damn shame to miss things. So a friend of mine, I was on the phone with a psychiatrist up in Virginia. Brilliant guy. He's the smartest psychiatrist I've ever met. You know, it's a shame. I've been trying to get him to move to this area.
It's not happening.
It's not going to happen. He lives on top of a mountain. It's awesome. The guy
he's in like a Mecca. He's not leaving.
Brilliant guy. So he was telling me about a mutual patient from years ago, a gal that I used to do ECTs with him, electroconvulsive therapies. We would do these on some mornings. You know, I had this setup. I would go ahead and knock them silly. He would do the electricity. You know, so I called myself Duke Power and Light. You know, he went ahead and took care of the
That's me
issues.
banging my head against my.
So a lady that we were never able to get right, 17 years.
Tell it.
He went ahead and fixed her by taking care of her gut.
Oh.
Her brain started working in the nursing home, and after 27 years of having nothing, she started bouncing back.
Look at that. Here we go. All righty then. Welcome back. It's Stages of Life Radio here on News Radio WFLA Orlando. We were talking before the break, Dr. Klein, about a texter who checked in and said flu symptoms. Some people had, for a week. Some had a couple of days. But all were complaining about the Moderna one, which is the vaccine that you and I and Linda all had.
Yeah, and what happens is when you get the vaccine, whether it's Pfizer or Moderna, they're very, very similar in the way they're set up. It really determines, what makes you sick, what doesn't make you sick, is your individual immune system and how you react to it. The sicker you get from it, the better the immune system you have and the better the response you're going to have. At stages of life, what we do is we measure the antibody levels. Now, we're the only lab, I think, in the country that can do this, and that's to tell you how much you've got. So when I got sick with COVID, I got sick the 1st of January. I was tested on the 2nd. Wasn't told that I had COVID until the 3rd, which was actually after I got the inoculation. So the morning of the 3rd, I got the shot. That night, I was told by my lab technician, "Gee, doc, you can't go to work tomorrow or for the next 2 or 3 or more weeks." So Tess, we tested her the following day. She was positive as well. We both got it at the same restaurant out by the beach. So what happened was I decided to go ahead and check our antibody levels on a weekly basis. Now, why would I do that? The answer is I can, because it's my lab. I'll do what I want to do. And what I found was that my antibody levels, having received the Moderna injection, started going up after 7 or 8 days. The first time I drew the blood after the inoculation, my levels were high. Tests were not. They were not high at all. They were not detectable. 2 weeks later, we checked hers again. Mine are going up. Hers are still low. And it wasn't until after we did the inoculation, which was after 3 weeks, that she started to see any antibody levels at all. And then they jacked up. They went up. So what we're finding, and this data is not available outside of this studio, except for, and that's this, that the response that you get from the inoculations is about 20 to 30 times greater than if you get the disease by itself. How would I know that? The answer is about 15,000 patients over the past year. We've been checking these levels. And what we're finding is that when you get the illness, when you get the crud, when you get the plague, as it turns out to be,
as it were,
the plague, the levels that you get, the units, I haven't really decided what I want to call them yet. I think IU is just working just fine. International units are somewhere between 5 and 8. When you get the inoculation, they could be 30, 40, 50 or greater. Now, why do you care? And the answer is because the higher the level, the greater they are going to persist in your system. So I want you to think about it as if it were a gallon jug of water and you poke a hole in it. Predictably, it's going to dribble out at a rate. Okay, but it's going to dribble out over a longer period of time than if you had a styrofoam cup and punched the same size hole into it. So a little cup, a little bit of water, it's going to wear out quickly. So how long can you expect immunity to last from somebody getting the infection? And the answer is 3 to 4, 5 months. Oh. And that has borne out because I've been checking people's levels even after they've gotten sick. They drop to normal after about that period of time. But the levels are so much higher after the inoculation that you would expect that they would last a good deal longer. So here we're into March. It's only been 8 weeks since we've had these inoculations available, really. So it's a little too soon to really know exactly how much more. But I'm beginning to see from the decay curve that it's going to be about 12 months. So you're going to probably need to get a booster shot in 8 to 12 months and just get used to the idea that you're going to need it. Okay. With regards to the Moderna being more difficult on the system than Pfizer, not a chance.
No.
I got the Moderna. But Tess, my wife, got the Pfizer. She actually got sicker than I did. Now, what did I do? I had a muscle ache in my shoulder. Oh, that was terrible. It lasted about 8 hours. And then after the second one, I felt a little achy here and achy there. That lasted about 3 hours. She felt feverish, although she wasn't. She didn't have a fever. All of it went away after 8 hours. Some people, they may feel a little bit longer. But that's the nature of an interferon-generating reaction. That's why you feel bad with the flu. It's the muscle aching over that's coming from interferon, which is your body trying to fight it off. This is a good thing, not a bad thing. And, understand that it's a whole lot better to feel crummy for a day than it is to die. Yeah. Okay? The death part of it really should concern you.
It's not a good
thing.
That
really, really stinks. Okay? So 600,000 people are going to die, and then you got somebody who's complaining about some muscle aches. I am so terribly sorry. Just suck it up and get it done. Don't be a coward. Don't be a coward. Okay, and that's I don't want to get it because I'm afraid. I had somebody the other day tell me that, I'm not going to get it, because I'm afraid of the side effects. But if they tell me I have to do it to fly to travel, I'll do it.
Side effect is death.
That makes you a travel prostitute.
You don't take it.
You know what I mean? You're going to roll over for the price of a plane ticket.
Hello, Richard. Richard is checking in from Orlando. You calling for a friend of yours? Is that right?
Oh, I've heard this one before.
Yeah.
So,
Richard.
Oh, yes, I'm here. Hi.
There we go. What's up, my friend?
Hi, Richard.
Yes, I'm a patient of yours, doctor. I'm always calling for friends out of state. I have a friend with IPF, pulmonary fibrosis,
idiopathic pulmonary fibrosis, sure. So that's a miserable problem. Go on.
Yeah, well, he's at the point now where he's had medication to control that they're looking at a lung transplant. Yeah. I was just going to try to get your angle. I mean, they're obviously giving him medication. There's going to be all kinds of things related to the transplant.
Sure.
Any nutraceutical, anything else you recommend before, during, after to help him with some sort of relief?
There are a couple things he should be doing anyway. So idiopathic pulmonary fibrosis is thought to be an autoimmune disorder. So you start going after the things that can modulate the immune system. And the most common thing that you can do, most easiest thing, most economical thing is vitamin D3. So I would get them started on 5 to 10,000 units of vitamin D3. That's just the way you do it. And you take it with a fish oil, otherwise it won't absorb. The second thing you need to do is to go ahead with N-acetylcysteine or NAC and guaifenesin. Now, NAC is really interesting stuff. The story with NAC is that it's an expectorant, but it's also an antioxidant. So when you're taking N-acetylcysteine, it's very, very helpful to keep the lungs opened up. The other thing about NAC, which is very interesting with pulmonary fibrosis, is that eventually, if he's not already using inhalers, you can make your own inhalers with the NAC and save a ton of money with it. So you get a nebulizer. Well, the nebulizers, they're $8 or $10 each. You got to use 3 to 4 per day, and pretty soon your checking account is depleted. Yeah. You can make your own nebulizers using over-the-counter N-acetylcysteine, a 10 ml syringe, and tap water. And what you do is you take that N-acetylcysteine capsule, 500 milligrams, pop it in the 10 ml syringe by pulling the plunger out the back, filling it with water with your thumb over the spout, shake it a few times, put the plunger back in. Then you squeeze off 1 ml into the nebulizer machine. And what do you know? You just saved yourself $10. So that is a nebulizer that's just like a gift, an absolute gift, N-acetylcysteine. Glutathione is very helpful under the same circumstances. So that's pretty much where you want to be with this for the time being. And give that a whack. Give them my regards and tell them that we're thinking about them, because there's nothing more fun than a lung transplant.
Thanks, man. Appreciate that. 407-422-1212. Is supranuclear palsy hereditary?
Yeah, well, I don't think it's hereditary, but it will scare the heck out of you if you have somebody kin with it. That is a type of dementia that will really it'll scare the bejesus out of you. It's bad news.
It's not hereditary per se.
It's not thought to be. It's thought to be toxic.
Well, that's why it's so scary. If you've seen somebody go through it, God forbid you want that
this
being
is bad.
Handed down.
I wouldn't wish this on anybody.
Right.
But sometimes you'll see it following what are called ergot medications, which were used in the past for migraine. Yep. So I'd be curious to see whether or not the individual with a supranuclear palsy had been migrainer. Had been taking ergots.
Let's get a grant and go ahead and plug in.
Get a grant? Yeah, that's. I've always been real successful getting grants.
Me either.
They usually laugh at me.
23680. Those are the numbers to mash into your message.
But that's That's a really scary problem.
And I get a text over to us again. Yeah, it is 23680. Thankfully, I am glad that it is not hereditary.
No, it's not hereditary.
That's a good thing.
But what happens very, very commonly, people with this, because there's no known cause. And when something has no known cause, the first thing you start thinking about is it's got to be familial. No, it's not. No, but it's toxic in some
For more
way.
information on anything that we've been discussing here today and a plethora more topics, go to stagesofliferadio.com. You can listen to all kinds of snippets of Dr. Klein talking, again, on a myriad of topics. And they're all very entertaining. They're like 5 to 10 minutes long, and they will help you figure it all out without having to do a Google search.
And it's largely commercial free.
Yeah, and for the best part about it, it is actually free.
Absolutely.
So there you go. All right, we'll be right back. You're listening to Stages of Life Radio on News Radio WFLA Orlando. Boop. Okay, so anyway, Linda says she's hungry for meat and potatoes. Oh, hey, there we go. Is the J&J vaccine safer for someone who has hypothyroid and allergies to aspirin and cat dander?
No. In order to make this more fun, I've got to say more. The Johnson & Johnson vaccine isn't safer or better. In fact, it's less effective. Its main use...
People want to fight you on that.
Oh, that's fine. They can fight me all they want to. I'm just an expert in the field. The story with the J&J is that its effectiveness is about 2/3 that of the Pfizer or Moderna. The main advantage, you only have to get one shot. And you got some people out there that are just so important and just so busy that they can't spend that 30 minutes, and that are their sissies. Or they're transients.
One and done.
So we're going to go ahead and pop you, knowing full well that you're not going to come back.
Never coming back.
Yeah. And that's pretty much what it boils down to. So is it the better one? No. I would have stood in line for the Moderna. In fact, I did. My wife got the Pfizer. She did fine with it. I would suggest one of the two. If you really insist on going to get the J&J, then accept the fact that you're going to be getting a booster. You're going to get that second one sooner rather than later anyway.
Probably so.
But I haven't had the opportunity to check antibody levels in anybody that's had the J&J.
You know, you will be able to. A couple of your patients that
I'm sure a couple
our
of them do.
friends do. They took the J&J and swear by it. I'll tell you later.
Yeah.
Marilyn's checking in online. We've got about 40 seconds, or you could drag it over. Again, someone with bad allergies, allergic to penicillin, milk, cheese, and large polyps. What do you think about vaccine for that?
I think it's a great idea.
Go ahead and take it.
Okay, what we're going to do after the break, Marilyn, I'm going to talk about what's in the vaccine, which is going to make your question very obvious.
Okay. All right. Cool. All right. So, whoops, did I mess up? I messed up. I did. I messed up the math. So it's not really back yet. I'll just start it like it is. We'll just start like right in the middle. Be like, this will be fun. Ready? Here we go.
There.
Welcome back to Stages of Life Radio. You didn't miss anything. Just kidding. Hey, it's Dr. David Klein. I am Melissa Fox. Stages of Life, medicalinstitute.com. And check out the Contact Us New Patient portal stuff. Become a new patient. He's always accepting new challenges.
Yeah.
And patients,
Bring
too.
me the hard ones.
Okay, so Marilyn checked in. She's watching on our Facebook live feed on the Stages of Life page on Facebook. And she said, what advice on taking the vaccine do you have for people who have bad allergies? Allergic to everything, penicillin, milk, cheese, everything that enlarges or polyps.
Yeah.
So tell us what's in the vaccine, and then maybe we can figure out if we should be allergic to it.
Right. Okay, so you're not ever going to be allergic to anything the first time you're exposed to it. Okay, that's the first thing you need to know about allergies. It takes repetitive exposures over a short or reasonably short period of time in order for your body to start developing allergic problems. So the first time you got penicillin we're not allergic to it. It may have been the second or third time, and then bam, milk you've been exposed to since you're an infant. Cheese, same kind of a deal. So what is in the Moderna and the Pfizer vaccines entirely? What are they made up of? And it's this: a little bit of salt, a little bit of sugar, some messenger RNA, okay, a small amount of it, and then something that's akin to the lipid, the oil that you see, the fat that you see in chicken soup.
So it's something to break it down?
No. What happens is that if you've ever sat back and made chicken stock or turkey stock,
you just watch the fat bubble
watch
up.
the fat bubble up and you see the little globules. Mm-hmm. So that is what the fat's for when they do the injection, is to surround and protect the messenger RNA.
Okay, so I had the math was right in my mind, but
you're getting there.
Out the mouth came wrong.
Right, but it's purified. It is not anything that you're likely to be allergic to. You're not going to be allergic to the salt and sugar. They're there to balance the pH, just the way that it works, the osmolality of the injection. Otherwise, it might hurt, which it doesn't. It doesn't tickle, but it doesn't hurt. The mRNA, you're not going to feel. What causes the irritation is the same thing that causes these things to be effective, which is that lipid. The macrophages come in, they notice that there's something not quite right, and they eat that lipid lunch. They go ahead and they eat that chicken soup that was just injected into you. And that causes the macrophages to develop these little nubbins of protein that look like the corona on the coronavirus. It's the way this thing works. And so that starts the process. It's actually just exactly what you want to see. There is no reactivity or allergy to anything. Nothing. So I tell people, go ahead and do it. Well, my immune system's no good. No, if your immune system is no good, get the vaccine, because you're going to need whatever help you can get to fight it, because you're the person that's likely to die from it. So what's the difference between the vaccine and the virus? The virus has full genetic expression. It actually can replicate itself, whereas the messenger RNA can't. It doesn't do anything but produce this one protein. When you get COVID-19, one of the reasons why people do badly with it, well, they start getting sick, and then they start feeling better, and then they take a hosing. Things get worse. It's because it inhibits the immune system. One of the things about the coronavirus, similar in some ways to AIDS, is it inhibits your immune system. So you end up with a tremendous hit of this viral DNA, RNA, and it just keeps going and going and going, but your immune system does not protect you. So the big fight here, okay, is how do we get your immune system to ramp upwards? I will tell you that the Moderna and the Pfizer work. I don't know about the J&J. I've got over 10,000 assays following the Moderna and the Pfizer. I can't tell you much about the J&J. I will in about a month and a half.
Okay.
Then I will have sufficient data. But I still can't get anybody at the CDC to listen to me or even pick up the phone. Hey, I've got this data. Would you like it? We can do a data dump, give it all to you. Can't get anybody to answer the phone. So much for my tax dollars and yours. You know what I mean? Well, we're going to talk about masks. Oh, okay. There you go. We'll talk about masks. We could talk about masks all day long.
Okay, hey, we got a quick question here off the text line. 47-year-old daughter had thyroid ultrasound. Thyroid is swollen on the armor.
Okay, so we have a 47-year-old gal.
Has had COVID.
Yeah, and a swollen thyroid. So she's on armor thyroid, which is a good choice. Okay, because that's a mixed mixture of T4, T3, a little bit of T1, T2. But when you see the ultrasound swollen like that, it means that she has thyroiditis, autoimmune thyroid disease. So would COVID make it worse? Probably not. Okay, so would the thyroid cause it? The answer is no. You want to treat the thyroid, you want to treat the COVID, you want to take care of the whole shooting match. I have thyroiditis. I got COVID. It sucks. Did it give me a sore throat? I had a sore throat anyway, from the thyroiditis. So yes. So could that cause the thyroid to be inflamed? The answer is no. It's not. It's a different type of virus.
It's got to be something else, or it's fighting something.
But it's a good question. I mean, it's a really good question. But that's what you want to do. If you have thyroiditis, you get periodic ultrasounds because it helps you with the control. You're getting the disease under control. There's some other little tricks you can do. If you know that you have thyroiditis, one way to shut it down fast is to use topical anti-inflammatories. You just have to be very, very careful. My favorite is Voltaren gel, and you just rub it over the thyroid, and in about 5 minutes it shuts down, but it can make you slow down pretty quick. It's like, but it does work.
Okay, so
what
that
else
works.
We got there?
That's actually about it. We had a response back from the super nuclear palsy.
So they don't know of any migraine meds that we're taking. Yeah. So they're different than the migraine medications that are available now. Okay, they're what they did, which was very interesting, was they caused a type of vascular constriction that you just don't see with any of the others.
Well, no, but was it the early 90s when they finally came out with the right ones?
Well, yeah, those were called triptans.
Yeah.
Okay, I was in the original studies with those. I had the biggest headache and facial pain clinic in the country.
You are a pretty big headache,
Yeah, well, I'm a big headache, all right. But I had the largest headache center in the country.
Ooh.
And so they approached me to do that. But the ergots were used for many, many years. The ergot alkaloids, and those were the things that tended to shut down these small blood vessels in the brain, but also in the kidneys and elsewhere.
Got a quick last minute one. Try to squeeze it in here.
Sure.
My husband takes Provastatin for bad cholesterol. Are there any better options?
Yeah, there are lots of better options. The problem with the statins is they shut down the conversion of cholesterol to pregnenolone. So you'll end up seeing memory issues, muscular issues, nerve issues as well. So the way that you fix the thyroid, by fixing the cholesterol, is by looking at the thyroid first. One of the easiest symptoms of hypothyroidism is elevations in cholesterol. So before we had TSH assays, we looked at cholesterol. If it was elevated, we treated with thyroid hormone.
Well, it's all part of the same ballpark.
It's all part of the same thing.
Which is weird.
So what do I do? I had elevated cholesterol. I treated my thyroid, the cholesterol dropped to normal. That really is your best way to do it. I've never taken a statin tablet in my life.
Look at that. So if you want to become a patient of Dr. Klein, Stages of Life Medical Institute is a piano's throw off of I-4 at the Longwood exit, 1917 Booth Circle. It's right across from the Four Rivers.
Yeah, conveniently located across the street from Four Rivers. Yeah, it's not a bad place to be. Starbucks, a lot of places.
So anyway, go to stagesoflifemedicalinstitute.com and hit the Contact Us tab. Follow that, or give a call during business hours, 407-679-3337.
Nicely done. Or if you happen to be in the neighborhood and you just want to look at us,
pop in.
Just pop in. We're there Monday through Thursday. If you're sick on Friday, you're on your own. And so just see if we fit into your type of life.
Yep.
We'd be happy to talk to you.
Again, stagesoflifemedicalinstitute.com. Any nutraceuticals that we talked about can be found at stagesoflifevitamins.com. Dr. Dave, it's time to say goodbye. We'll catch you again next Sunday at 4 o'clock.
Indeed, Armando. Talk to you then.
All right, then. Y'all take care. I'll see you tomorrow morning with Good Morning Orlando. You're listening to News Radio WFLA Orlando.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com or stop by 1917 Booth Circle in Longwood near the intersection of I-4 and 4th